Our culture really tends to normalize alcohol use for really kind of unhealthy reasons, for coping, stress relief, emotional problems, etc. That got worse during the pandemic, of course, as people didn't have access to a lot of their normal coping mechanisms. But a lot of that culture promotes really unhealthy alcohol use that's heavier than it should be. So we started the Multidisciplinary Alcohol-Related Liver Disease, or ALD, clinic about a little over 3 years ago, just about 3 years ago. And it really rose from a frustration on my part, actually, that the work that I could do as a liver doctor was somewhat limited with my ALD patients. The biggest problem that they had was that there was ongoing drinking and they needed help stopping. And it was really difficult to get mental health care, to get substance use care, to get people connected.
So the clinic is unique because it takes psychiatric and substance use disorder or addiction resources and liver medicine resources and puts them together in the same clinic, treating the same patients at the same time. Sarah is a very typical representation of the patients we see. The challenge in the alcohol-related liver disease population is there is a wide array of disorders and psychosocial challenges in addition to the medical pathology. So we understood from her early on that not only did she have a severe alcohol use disorder, but she also struggled with anxiety and had for some time. Additionally, she dealt with a lot of chronic pain. So if you consider how broad that is, from her liver disease to a pain syndrome to kind of a general psychiatric problem of anxiety, in addition to substance use challenges that include alcohol and other substances, that's enormous.
I'm proud and I'm happy and I'm glad to be in the position that I am now. And without the clinic, without that holistic approach, without having everybody there saying, this is what you need to do, we're gonna get you there, I honestly would have died.
As stories like Sarah's get out and as we hear more about the rates of rise in young people, in young women, but really all demographics, this is happening across all age groups, it's really becoming kind of more of a dramatic point for people that this disease that we thought was a disease of middle and later age is not. It's happening in your 30s, your early 40s. I think if you think that you might be drinking for unhealthy reasons, if you think you're drinking too much, you probably are, and it might be time to ask for help. And there's a lot of good places you can go to for help.